Health Innovations, the role of technology in maintaining and improving access to care and health outcomes, is presented by the Greater Harlem Chamber of Commerce. First, I'd like to introduce our moderator, Padmore John, Assistant Commissioner of the Bureau of Harlem Neighborhood Health at NYC Health. Padmore is joined by Dr. Pamela R. Drullinsky, breast oncologist and physician site director at the MSK Ralph Lauren Center. Dr. Sharique Nazir, Chief of Bariatric and Robotic Surgery at NYC Health and Hospitals Harlem, and Assistant Professor at Columbia University. We also have Deborah A. Levine, Director of the Harlem Health Initiative at CUNY's School of Public Health. Opening remarks for this session is Eichakeem McClary, Executive Vice President and Chief Legal Officer at United Way of New York City. She leads strategic initiatives that drive equity and impact across communities rooted in her East Harlem upbringing and legal expertise. Ladies and gentlemen, please give it up for our speakers.
We are so glad to be here with you today. I'm Eichakeem McClary. I'm Executive Vice President at United Way of New York City. I'm also a lifelong Harlemite. So I'm honored to be here today. I grew up in East Harlem and I've been living on Sugar Hill for over 20 years. So I'm here representing not just United Way of New York City, but also the Harlem community. For 87 years, United Way of New York City has worked with a coalition of trusted partners to unite community power with citywide possibility. Together, we meet today's challenges while building transformative solutions for tomorrow, striving for health, opportunity, and prosperity for every New Yorker in every neighborhood. I'm here today to speak about our work in the healthcare space, specifically at the intersection of health technology and health equity, or TEQuity. TEQuity is basically the concept that technology should be designed and used in ways that reduce inequities, and in this case, healthcare inequities. At United Way of New York City, we work alongside communities like Harlem, in some cases using technology to harness the strength of neighborhoods and break down barriers to care. Our communities have always been more than just places where you live. They are hubs of innovation and support, and in some cases, TEQuity. With our partners, we recently implemented a new technology platform called ConnectYouWU.NYC. This tool allows New Yorkers to receive referrals and information about free or reduced price services that address social determinants of health, similar to what Chef Lex was talking about earlier. Things like childcare, food, transportation, legal services, and health insurance. The platform curates local organizations based on a person's zip code and focuses on making connections to hyper-local care, addressing community needs right in your community. This is the technology side of United Way of New York City's Connect to Care program, which aims to improve access to health resources, screenings, out-of-hospital preventative care, and support services for under and uninsured New Yorkers who are vulnerable to chronic diseases like diabetes. Connect to Care and the associated ConnectYouWU.NYC technology strengthens the capacity of over 25 partnering community-based organizations to be a resource to community members and for community members to be empowered in improving their health outcomes. And that is the transformative power of technology. It provides access to information like healthcare data that is often out of reach to our neighbors in Harlem. Lack of access to data can negatively impact not only individual health outcomes, but it also affects community strength and resilience. We have a responsibility to address this, and United Way of New York City is doing just that. Last year, we worked with community-based organizations to conduct 5,000 free preventative health screenings and train over 70 healthcare staff, members and advocates across the 5 boroughs of New York City. Similarly, one of United Way of New York City's other programs called Choose Healthy Life, and I hope you were able to see our team outside who were providing health screenings, provides critical resources and tools to 30 Black churches across New York State to enable them to themselves be providing wellness screenings, preventative health services, and health education. The program was founded in 2021 during the pandemic, and Choose Healthy Life trains up health navigators within our communities to help us address the underlying health inequities that are there. We're honored to partner with Choose Healthy Life, with the pastors in the churches, and also with health navigators to bring these services to neighborhoods like Harlem and all others around the city. At the end of the day, access to information, whether through technology or credible community messengers, is critical to ensuring that all New Yorkers have the necessary resources to live a healthy life, regardless of zip code or any other factors. So as I close, I invite you to learn more about ConnectYouWU.NYC at connect.unitedwaynyc.org. Thank you for having me, and thank you all from Black Health Matters and from the Harlem community for putting on this really timely event, because we all know that our communities are healthier when we work together. Thank you very much.
Thank you. Thank you, Ms. McClary. Appreciate that. Great deal of big support to all the stuff that's happening in our Community United Way. Thank you all for you being here and for hanging out with us for so long. We know it's been a long day, and hopefully you've gotten a lot of good information as well as some good food, and also made some connection to some of the best experts, professionals, experienced individuals who can provide you the best information that you need. And so hopefully for today, as well as all going forward in terms of addressing all your healthcare needs. So we're gonna have a little bit of a discussion here. I also wanna make sure that we recognize Deborah Paulino from HCCI, who is joining us on the panel as well. So our discussion is around health and technology. We all have one of these in our pockets. That's technology, right? And it can be used for good or it can be used for bad. So, and there are other forms of technology as well, and we'll talk a little bit more about that. But to make sure that as we move forward, that we are getting the best use of technology for our community and for ourselves. So I'm gonna ask the panelists to introduce themselves, and as they're doing that, speak a little bit about how technology is utilized by their institutions and how they're considering equity in that space as well. So we'll start with Dr. Nazir.
Thank you very much for having me here. And I was invited by my CEO, Mr. LeConte, to come and give a talk and share my experience. And it's my honor today to be here and present among you all. A brief story before I start. You know, Harlem Hospital has been serving the huge community, and it's part of Manhattan. And I was working at NYU Langone Hospital for many years, for the last 10 years. And my leaders in my hospital, Mr. LeConte, Morris Wright, a visionary leader, when they see the other hospitals in New York itself, like Cornell, Columbia, you know, NYU, Methodist Hospital, they have robot. Robot is a high technology, state-of-art tool to operate. For example, when you call a plumber or a craftsman in your house, and if you don't give them a tool to work, they cannot work. They cannot perform the service by the hand. Things has gone, you know, differently nowadays. So they had a vision. They invited me, and I had something to give back to the community. So their vision and my belief basically matched. We launched a robotic program at Harlem Hospital, which is state-of-art surgery. And when I came in here, people was doing open operations, traditional surgeries with a lot of complications happening left and right. We established the robotic program at Harlem. We trained 6 surgeons there, and we changed the concept of the operation from open to minimal invasive state-of-art, which is a robotic technology. And the people who's been going from Harlem to other places, going miles and miles, they are basically staying here and we're serving the community. So that's the joy we get it from this technology. Thank you.
So really quickly, this is happening in our community. We're having advanced state-of-the-art robotic surgery at Harlem Hospital. All right? That's where we are now. And that's what you have access to. Dr. Drullinsky.
Hi, my name is Pamela Drullinsky. I'm a medical oncologist with Memorial Sloan Kettering for over 30 years, and my specialty is breast cancer. So first I wanted to talk about the cell phone that we all have in our pocket. Most hospital, actually say every hospital and most medical practices now have an app. And one of the best things technology has had is build trust and I think transparency. So I just wanted to say as a physician, one of the things we like is everyone looking in their charts and seeing what we're thinking, because no one is trying to deceive anyone. And so it's open access. And if there's a question, I think it's very good to reach out to your primary care, your gynecologist, or whatever other specialist someone is seeing. The other question was about the mobile health unit. Should we talk about that now or later?
We'll come back to that.
Okay, we'll come back to
but
that.
I just want to reiterate what Dr. Drullinsky was saying. You have the ability to have your chart, your files on your phone for all of your procedures with you. Before, you had to go to your doctor, you had to make a request, sometimes you had to pay to get that. This is the way you can set it up. You sign in, you have access right away, you know what's going on. So please utilize these benefits. Ms. Paulino from HCC.
Hello, good afternoon, everyone. My name is Deborah Paulino, and I am the Director for Senior Services. I am with Harlem Congregation for Community Improvements. We are committed to reviving Harlem and making sure that our residents receive affordable housing, but also assisting them in maintaining those, those programs. We also offer empowerment opportunities for our younger folks and even seniors to be able to sustain themselves within their communities. As a director for seniors, I see a lot of challenges, but also a lot of good things with technology, because we deal with a lot of seniors who have mobility issues. And like the doctor was mentioning here, little things like my chart, like she mentioned, a lot of times we could assist with just getting into their profile and letting them see what was the results, and as opposed to them taking that trip to hospitals, to get those results. Are we gonna come back to like other topics?
Yes.
Okay, so I'll cut up there. I can go on for days, but I'll cut up there. Thank you.
So addressing some of the needs of the seniors, and especially in terms of how we might be able to utilize healthcare, technology, and mental health as well. And so I'll also throw that over to Deborah Levine.
Good afternoon, everyone. How you doing? So my name is Deborah Levine. I'm the Community Engagement Officer for your City University Graduate School of Public Health and Health Policy. And that's a mouthful, for sure. So the way technology shows up for us is, I'll give you an example. During COVID, you needed to be able to make an appointment to get tested or to get vaccinated. What we had was technology that allowed us to be able to go in and make those appointments and be able to follow up whether you had version 1, version 2. We help in terms of helping providers make technology that is easy to use, and so that community members can really help get the information that they need. So that's the way that the School of Public Health shows up and works with our providers, works with the Department of Health, works with organizations like Black Health around creating mechanisms so that we can have a healthier community and that community members are able to access science-based information that we know is critical to keeping our health and wellness.
Thank you so much. Data is so important, and the way to capture some of that data that we're using, and this is especially the way the Department of Health works, in terms of where are the resources most needed? Where are we seeing the most critical issues that are happening in the community? And how can we deploy the resources to address those based on what we're seeing? So I want to go into just a little bit, dive into some more of the work that you're doing, and specifically to ask, how are you seeing, there are obviously good aspects of technology and bad aspects, and what are we, especially around how we are addressing equity, making sure there's equal access, as well as some of the things that potentially could be negative in the use of technology. How are you and your institutions addressing some of those issues?
I believe, when you talk about the equality and equity, I always believe that one portion, like in New York City, if some hospitals have higher technology and other hospital does not have any technology, so there's a huge health gap. You just call health burden, you can tell. So when you bring the technology in one population and other population also has the same technology, then you reduce the burden and that is called equality and equity you're talking about. So technology, we have to embrace. Things are changing. And most important thing, I'm happy that you guys are listening here because a lot of people are very, very afraid of technology. I'll give you one example. We were two surgeons working in the hospital. And I was a robotic trained surgeon, and my partner was an open fashion surgeon. So when the patient comes to that doctor, what he advises that, look, you want me to operate or robot to operate? So he's giving a wrong information to the patients. So that's why we have to learn the technology and we have to embrace it. So if you learn the technology and you can get a lot of help from the technology stuff. So when we perform, the state of art by robot surgeries, there are a lot of benefits. I just kind of take a couple of minutes because it's a nice platform to educate everyone over here. The most important benefit the people will get that you go back to see your loved ones. You don't need to stay in the hospital for weeks and months when you do the robotic operation. I just performed a surgery yesterday, big operations. You will never imagine that guy within 2 hours, he was sitting in the PACU, which is post-recovery room, ready to go home. So you see the technology changes completely. When you go and do an open operation, people stay in the hospital for weeks and months. I historically from India, and I was in India just last week, and I was visiting the hospitals, my family owns there, and I see people getting gallbladder operations, hernia operation, staying for weeks post-surgery. So that's why we have to embrace, we have to know, and we have to accept these things. Thank you.
Thank you. Dr. Polinsky, I know one of the key things, and we have a couple of the vans here today, the mobile mammography van, as well as the PSA test, the prostate cancer testing van. That's an aspect of technology, being able to take that, instead of having individuals come to the hospital, literally it's coming to them. Can you talk about the benefits of that and how that's used?
So thank you for the question. So we're very lucky to live in New York because we're surrounded by hospitals. And one of the problems, though, is lack of insurance. And everyone's busy with work and family, and some of us just don't make appointments to see a physician and get checkups. And as an oncologist, I can tell you that cancer is very curable if picked up early. So different hospitals have different plans. I think the Mount Sinai van that's here is encouraging PSA testing. The American Italian Association van is now doing mammography on the van. Sloan Kettering's van, which I work for, is not here. But they reach out to communities that are typically underserved, immigrants and embassies and just in general Harlem community to encourage insurance and screening and things like that. So what we do on the van is check blood pressure, sugars, give patients information regarding primary care, help enroll patients in Medicaid. Without insurance, New York State is actually extremely flexible. The Cancer Services Program of New York State covers for free cervical cancer screening, mammography, and colorectal screening, so you don't even need insurance. And so the cancer screening is what we offer, and we make appointments at the Ralph Lauren Center right here on 124th Street in Madison, because Sloan Kettering was one of the hospitals that branched out from the main center to try to increase education in cancer screening, and again, because it's so curable when picked up early.
Thank you. Now, I know one of the things, especially that has been a consequence of COVID, has been a lot of individuals now who are more alone. The social connectedness is not there. Deborah, do you mind just speaking to that and how technology can help address that in terms of providing some amount of connectedness, especially for seniors or other populations that need for that, where there's a need for that?
Yes. So with seniors, we know that it could be very difficult for them to know and learn how to navigate cell phones. Sometimes, it becomes harder for that population, but it's never too late to learn. So what we focus primarily is assisting our residents with learning how to navigate their phones, creating emails, and also, most importantly, assisting them and letting them know that it's okay to have virtual telehealth, and it's okay to see their doctors through telehealth, because a lot of them are uncomfortable because they feel ashamed of not knowing how to work the cell phones or a computer. Also, I always tell them the goal here is to help you guys be okay and be safe and not walk outside, and because you're hearing impaired and we're afraid to maybe, attempt to actually take advantage of a telehealth call. Now, God forbid, you're in an accident because a car hits you and you probably didn't see that coming. So the ultimate goal is to make our seniors feel comfortable with being virtually seen, letting them know they can have access to seeing their medical records, and also how it can serve as a good emotional thing for them, right? A lot of our seniors are lonely. They don't have no family. Sometimes they're the last person alive of their family. So a lot of times this also helps them with their social emotion aspect of life, because now they're actually having interaction with someone in a camera, or looking forward to speaking with someone, or at least explaining to them how they feel, and waiting for that feedback to be told back to them. So I think it's very positive for our seniors to have that, specifically those that are lonely and with no families. And I think as technology is progressing, they are slowly getting comfortable with that. But there's also other things, like there's sometimes seniors who are afraid of the whole being in a camera or a phone, and rather the in-person visits. And of course, at that point, we would also tell them, like, there's transportation to take you there, it's totally okay. And we would also assist them with making sure that that ride is, scheduled for them, so that they can actually make it to their appointments on time and not miss it. So I think that's good for me, so I can give her time to speak.
Well,
Go ahead.
now I'll toss it over to Deborah.
Yes.
I had the opportunity to go to the CUNY School of Public Health's front-facing office on 125th Street between Lenox and 5th. And there is a exhibition, a trace exhibition, recognizing the impact that COVID had on our community. I would encourage everyone to participate in going and check that out. One aspect of that exhibition is technology. Deborah, why don't you talk to us a little bit about that? Why that exhibition was utilized in that way, and just give us a little bit more about that exhibition.
Sure. So this was our way of honoring and creating a space for those that may have transitioned during COVID, or may have lost someone during COVID. And it's equivalent to like calling names so that we can keep those stories alive. One of the ways that we're able to also share that information has been through technology, and we're creating booklets and sorts of activities that people can use that can continue to share those stories, both visually and orderly, so that people can hear those stories. And so that's a great way that technology gets to get shared, is by sharing stories and having a way that, so your neighbor may not be able to hear you, your grandchild may live in another borough, but you want to keep those records alive of the history and the stories. And so that's really why we created a safe space to be able to do those kinds of recordings. And so for us, again, it's around health literacy and sharing how people can stay healthy. We find that when people are communicating that way, as we heard earlier with seniors, it really supports one's mental health in being able to connect when you physically can't be in the same room with someone. So like FaceTiming, things of that sort. So there's really a good side to technology in terms of the spiritual, physical, and emotional well-being. But I would also say that there are points where you have to be careful. You want to make sure that when you're opening an app or you're using an app, that it's a safe app, that it's an app that's from like the Department of Health or from Black Health, an organization that you know is a real credible organization that has real credible science-driven information. And so if you see things that are misspelled, you're seeing words that don't look right, that's probably going to be a site that you're not going to want to trust, and you're going to want to close so that you're not confusing yourself with misinformation. So as good as technology is, we also want to remind you to be mindful that there are some sites that don't have the best information.
Thank you about that. I thank you. I agree 100%. I also just want to reiterate the point that Deborah made about the Trace exhibition. Part of that exhibition is to keep our stories and to share our stories. So for the elders, the seniors that are in here, your story is going to benefit your children, your grandchildren, your great-grandchildren. So as I said, many of us have these phones. Our children have these phones. Ask them to record you. Record your story, how you got here. How long have you been living in Harlem? How did you come up here? Where did you come from? What are the challenges you had to overcome to be here? What have you seen change in your community? What would you like to see? What you want for them? Okay? I challenge you all to do that, and hopefully one day we'll be able to get all your stories out somewhere for everyone coming after us to be able to realize and work on as well. I want to go back to Harlem Hospital, Dr. Nazir. When I have been living in Harlem, I came in Harlem in 1987. So it looked very different back then. And I'll be honest, when I used to walk around Harlem Hospital, it wasn't a place that was very welcoming. I felt as if other hospitals in our other communities looked better, felt better, smelled better, had better equipment and everything. So I want you to talk to us about that investment, because that's important. Our moderator, our introducer said, health is wealth. Wealth is also health, right? So I want to just talk about the investment, the decision to come to robotic surgery, to bring the top tier technology to a typically underserved community. What that says, what that means, and what does it feel as a community within your hospital to have made that decision?
Yeah, that's a very good question. And when I was, I'm going to give you a story, my own. When I was living in NYU and joining the Harlem Hospital, everybody was looking at my eyes and look at my face. Is he in this good mind? He's okay. But when I came in here, I parked my car right on 136th Street and was walking, and I saw the sign there, Harlem is family, Harlem is community, Harlem is friends. Then I walked and I saw the people around. I said, these people really need me more than I was at NYU Hospital. And believe me, I'm here for last 2 years, and each and every day when I wake up, I can see my staff sitting here. My CEO who has so much passion for the Harlem community, he was in the middle of the meeting, he just came and so he's right now with us. So that investment is for the people of the Harlem. Because, we live in different world now. Everybody sees insurance, because I live in New Jersey, I work in New York. And I was in elite hospital in NYU. When everybody walks in the clinic, they look at the face, number one. Then they look at the peers, what insurance patient has it, number two factors. And then they look at the profession, what profession he is doing. Then they look at the zip code. So these are the variability, physicians and surgeons are looking at it. So, and when I came in here, that thing, like in state of art was missing. People come in here, they have no hope. You are the main hope as the surgeons. People are very resilient. And I find the two differences between Harlem patients and NYU patients. Harlem patients, it's like something they're looking at your eyes with some hope. But patients at NYU, they are demanding patients. Very, very demanding. And I'm not kidding, I'm just saying the correct fact. And if you deviate anything from the standard of care, then you get a phone call from your attorneys. And because that's the way. But I see completely different in this atmosphere. So that robotic surgery, I just want to say, I have a couple of minutes. That robotic surgery is for the patients. Because your incision is very low, very minimum incision. People don't even recognize what incision they have it. They go home on the same day. Within a couple of hours, they are home. They're back with the families. They're back with the loved ones. Number two, they go back to work pretty much. And the most important thing, I very much suffer, and pain is the most important commodity. People don't want pain. That's one of the dreadful things you can imagine. And pain is very, very minimal. So this is portion for a physician. Now I'm taking about the surgeon. You'd want surgeon who has a good hand. You don't want surgeon with the big hands in your belly, trying to fish around and looking at your bowel. I will never want. I don't want surgeon whose hand is shaking. Believe me. Because sometimes at certain age, your hand starts shaking, you can have coffee. So these are the things are not there in the robot. This robot is not the one who's going to operate. It's me operating, surgeon is operating. But that tremor, that hand shaking, that big hand in your belly is not there. So chances of infection is less, more precision in terms of the operation, and most important thing is the outcome, fabulous outcome, So I'm so much happy that, this disparity, which I was seeing before I came in 2 years ago, is going down now. And I've seen patients from Brooklyn, from Manhattan, looking at the Google. They're very smart people nowadays. They find you, they know where you are, believe me. When the patient comes to me, they sit for an hour, they say, Doc, I know you. So, because they do research. With the new technology, everything is like open now. They can know even where you're living. So if you make a mess with a patient, you will see them in front of the houses also. So I'm pretty happy that we have the technology to offer you. And another important thing I want to tell you what it does for the patients and what robotic surgery is doing for the patients. First of all, is life-changing operations. What life-changing surgeries? Because I've seen a lot of bariatric patients in terms of obese patients walking on the street. We just had a nice talk about chef, the food, and what we are eating. I myself, because I was on call last night, and there was no place to eat except gyro across the street with a lot of mayonnaise inside. And if you eat that type of food, what health you're going to get it? So That's important thing, what we are eating, okay? And the other thing is what technology is going to offer in your, in a field. So these are the things you have to look into it. So obesity is number one factors. Second thing, we do life, deep, everyday operations, like gallbladder surgeries, hernia operations, appendix operations. Then we do take care of the human, women welfare, like his, uterus problems. Then we do for the men's welfare, like prostate problems. Then we do the life-saving operations, cancer operations. Then we do for the organ operations. So these are the operations which have been started at Harlem, and community is enjoying. So the community is not going, if they know it, that some surgeons are performing, they do come, they get this opportunity. So these are the benefits we have with this technology. Thank you.
Thank you, Dr. Nazir. That's all in Harlem Hospital, 135th and Lenox, folks. You ain't got to go nowhere else. Dr. Drullinsky, I want you to tell me and tell us about how the results. How are you seeing outcomes? Are they improving by some of the use of technology, by the fact of this early screenings that are occurring, by even the latest technology in some of the screenings that happen within the hospital? Can you talk to us a little bit about that?
Yeah, so there are brand new CAT scans, PET scans, 3D mammography, tomosynthesis. All the technology has exploded, and again, in all of New York, we are so lucky that every hospital has usually, state of the art, the latest equipment. So the outcomes are fantastic. As an oncologist, I feel like I have to tell you that 50% of my consults are stage 4 in breast cancer, and it's just simply for women not going to get their mammograms. So in terms of technology, we are started a walk-in mammogram program, and there are QR codes, there's like posters and links everywhere so that every barrier of screening can be avoided, and if you could just walk in and get a test. So I just say again that the earlier you pick up cancer, the better. And Memorial Sloan Kettering Cancer Center obviously is right here in New York. We're here in Harlem. And if someone has cancer, they can have one of the best hospitals in the country in terms of cancer care. And we do research in technology, in CAT scans, in nuclear medicine and everything. So I just encourage everybody to get a checkup.
Thank you. Thank you. It's really important. Stage 4 is not good, right? Let's make sure that we all know that. Stage 4 is not, we do not want to get to that point. So the earlier you are able to do the screenings, the earlier you'll be able to do the testings, the better. The earlier you catch whatever the problem is, be able to fix it better. I want to, Pauline, I don't know if you know any of the apps that are out there. But can you just speak to a little bit of the apps? And Deborah, you can jump in on this as well. What I think that the issue is, we want to make sure, and you were talking about this earlier, that we are going to the right ones. We're going to the best ones. We're going to the ones that will give us the best information. And so even if you may not necessarily know some of the key ones, there's different ways of how folks can find out the information on the best apps while they to be able to make sure that they're getting the best information.
Yeah, so I know there's a few apps where residents can potentially benefit from, but like Deborah had mentioned also, we want to make sure that there are correct apps. So a lot of times your doctor will actually encourage you and actually specifically direct you to which app you should be looking forward to.
I'm going to interrupt you because I want to direct somebody.
Okay, go ahead.
So there's a lot of people taking supplements, and they can really interfere with your care. So MSK Herbs, there's an app that's free, and you can look up, a tea, an herb, and it doesn't judge you. It just gives you the science behind it, because YouTube is full of misinformation. You take vinegar and ice, and you can lose 50 pounds in a week. Really? No. So if you're interested in the Herbs app, I would say MSK Herbs, HERBS.
That's a good
That's
one.
what doctors do. We send people to the apps that are reliable.
Right. So for example, like if you go and get like a mammogram, depending on the hospital, let's say you went to, I don't know, Metropolitan or like Lenox Hill, your doctor is going to give you a paper indicating your results should be on Lennox Hair Radiology. You don't want to log into another hospital probably to get those results. So little things like that are very important, making sure that you know what hospital you go to, where you took your test, and what app you should be looking forward to getting your results from. So yeah. Deborah has info also, I believe, regarding that.
And Deborah, if you also, as you're going to speak to that, also, how are you seeing some of the changes that are happening because of technology, especially with mental health? Can you just speak to that as well?
Sure. So, full disclosure, I am also the first vice chair for the Harlem Hospital CAB. So, kudos to Harlem Hospital for having robotics and technology for our community. So, big up and claps for Harlem Hospital and our president and CEO who's with us today. As far as apps are concerned, you can do things like go to the Department of Health's website, and they have a list of resources of apps that we know are safe, that again have science-based information that make sure a lot of our hospitals, if you go to their websites and look in their programs, they're going to show you a list of programs and apps that are, again, approved, that we know have science-based information that you can share about your health and well-being. In terms of mental health, we've come a long way over the last 10 years in terms of apps that now can be used to connect people to mental health services. If you call 311, they will also give you some referrals around some apps that you can use to connect for support groups. I know that Black Health has some recommendations, and also in terms of apps. Some of your houses of worship are working with local community-based organizations that have developed apps that also provide support groups so that people may be homebound but still want to connect and can use an app to be able to join a group, be able to do FaceTime with their doctors to talk about medical concerns, or to be able to connect with other community-based organizations that may be doing things like webinars and talking about chronic diseases and treatment and care and where people can get access. So I would say to you that there is a ton of apps out there, applications that you can download, but I would suggest you be careful. Only use the ones that have been recommended by your physicians, by your trusted directors at your programs, by the hospitals that you're working with, by Black Health, who is going to guide you to make sure that the people that we're connecting you to are going to make sure that they're giving you information that is going to help you become healthier, that it will connect you to the people that can give you the resources, but most of all, will continue to help you to grow in your knowledge as you are taking care of yourself and others.
Thank you. I'm just going to leave it open to the panel. If there's any last words, we have 3 minutes. And are there any questions in the audience? Are we taking questions? I don't see anyone with mics, so I guess not. So I'm sorry, there are no mics around. So we're just going to go back to finish up from the point of view of the panelists.
My final advice is health is wealth, as was mentioned earlier. If health is gone, everything is gone. So please pay attention to your well-being, your health, because if health is with you, everybody will be with you. If your health is gone, you'll see people disappearing slowly and slowly, and you'll be left alone. And God bless you. We are here to serve you. And if you need anything, please feel free to come anytime. Thank you. Thanks for the invitation.
I think he said it well.
From my point of view, I would just say, don't feel ashamed if you're older, if you're a senior. Please speak out. Ask for assistance, learn how to navigate your phone, and also take advantage of all these programs that is, on your favor. So don't be ashamed and just speak up, because there is help out there to help you guys navigate your health. from the comfortability of your home.
I would just say really quickly, New York Public Library does training courses on how to navigate the internet. Places like HCCI do workshops all the time teaching people how to use. It's not just seniors. If you only use your phone to make a phone call or take a couple of pictures, and that's not what you do every day, there is no shame in asking for assistance and sitting down and having folks help you navigate. We can only get stronger if we work together. So make sure that if somebody is struggling, if you don't know the answer, send them to somebody who can help. And we're more than happy to sit with folks and help them navigate.
All right, thank you so much, everyone. I will just close out by saying that there are resources in your neighborhood. I operate out of East Harlem, 115th Street, between Lexington and 3rd. We have what we call our Action Center, and there's a wealth of resources there. The CUNY School of Public Health is on 125th Street. HCCI is a bunch of places throughout Harlem. We know where Harlem Hospital is. And of course, MSKC and all the work that they're doing in the various locations where they are as well. So we are so happy for you to have been here today. I also want to make sure that I recognize the role that Lloyd Williams had in putting together Harlem Week. He has done a lot for Harlem. One of the key things he has always said to me was, if we don't have our health, we do not have any wealth, right? And he has made that connection between health and wealth, economic growth, and the growth of our community. So thank you a lot. I hope you got some good information today. Continue to take care of your health, yourself, and your family, and your community, and all blessed. Thank you so much.
Just a quick thing, we have some brochure for obesity. If you want to get it from us, not many, but we're happy to share, and anybody needs some help. Thank you.